halls of the pharmacy building at Ohio Northern University in what appears to be an unfortunate outbreak of whooping cough in the village of Ada. After some careful investigation, it has been concluded that the spread of the disease started in the local daycare with a young child named Johnny Smith. The disease has slowly made its way to the elementary, middle, and high schools in Ada, and it did not take long to reach the university. The bacterium that causes this disease are passed on by mucus droplets and airborne particles. These particles attach to and multiply in the outer layers of the respiratory mucosa. Although the effects of whooping cough are most severe in younger children, people of all ages are affected by the disease. Earlier this week, we got some footage of Johnny Smith's doctor explaining to his mother what exactly whooping cough is, how it started, how it progressed, and the treatment that is needed if you or someone you know begins to have these symptoms yourself.
Hi, what brings you into the office today?
Well, my son Johnny's symptoms started with what I thought was the average cold. He had the cough, a little bit of a runny nose, and he had sometimes a loss of breath. He felt a little warm, but I thought he was just fighting the average cold. But his fever began to get a little worse after the first week. His cough started developing into more of a whoop and like a hack. The coughing was more constant, and he seemed to be having more trouble breathing with it, so that's when I took him out of school and decided to come into you to talk to you.
Okay, so your child has a paroxysmal cough, and after the coughing fit, he has a hard time breathing, like he's gasping for air?
Yes.
And how long again did you say it's been since the cold symptoms first appeared?
Around 1 to 2 weeks.
Well, it's a good thing you brought Johnny into the office today. Without any test results, I would conclude that Johnny has pertussis, but we will not know for sure until we would run some test results. Pertussis has a 5 to 10 day incubation period, which it starts off as the common cold, and then the disease progresses more into like the whooping cough as you have suggested. And children can get the whooping cough worse than adolescents and adults. So there are a few tests that we can run to see if he in fact tests positive. We can take a nasopharyngeal swab. The lab can run polymerase chain reactions on a sample of DNA, which provides accurate test up to 4 weeks of the cough onset, which he would fall into that category. Or they can run a serology test on a sample of blood serum, which is the most effective when the onset of the cough is between 2 to 8 weeks.
To understand this disease, it might be helpful to point out some of the key features of the bacteria that causes it. The bacteria in interest is called Bordetella pertussis. It takes the shape of a cocobacilli, as shown on the screen. The pill-like shaped bacilli are connected together, but not completely pinched off at the points of connection. Now, a word from our lab technician about the pathogenesis of pertussis.
Thanks, Kelsey. I'm here in the laboratory to discuss the pathogenesis of Bordetella pertussis. Bordetella pertussis enters the body through airborne particles and into the respiratory system. This bacterium then attaches to the epithelial cells of the upper respiratory tract. This bond is facilitated by binding domains on a protein called filamentous hemagglutinin adhesion. This protein contains a tripeptide composed of L-arginine, glycine, and L-aspartic acid. After the attachment to the epithelial cells, Bordetella pertussis sends adenylate synclase toxin into the neutrophils and catalyzes the excess production of cyclic adenosine monophosphate. Basically, this stops all phagocytosis in the cell to inhibit the cell's defenses. Pertussis toxin, also known as PT, also helps the bacteria because it inhibits the migration of lymphocytes and macrophages to the infected areas. Damage from Bordetella pertussis include loss of ciliated cells, cell blebbing, and mitochondrial damage. Local tissue damage to the epithelial cells is believed to cause the actual coughing associated with pertussis. Finally, the bacteria leaves the lungs and spreads to other people through the air.
Thank you for coming into the office today. We have the test results back of your son's culture. He does, in fact, test positive for pertussis, so it is very important that we take action immediately. There are a few antibiotics that can be used to treat this bacteria, depending on if he has any allergies and whatever your insurance covers. They are azithromycin, clarithromycin, and erythromycin, or we have Bactrim DS. And then in your case, or anyone who has been around your son within the past 2 weeks, the best action would be to be vaccinated for pertussis. If there have been any infants that have been around him, the vaccination is called DTaP, And then in adolescents and adults, they can get the vaccination called Tdap for pertussis.
Okay.
So I would highly encourage your family and anyone that has been around him to get that done as well.
All right.
So thank you for coming in today. I will write the script up for your son's antibiotics and send you guys on your way.
Thank you.
If you are one of the few people in the village who has not been affected by whooping cough yet, there are a couple steps that you should take to prevent the spread of this disease. You should get the pertussis vaccine immediately to protect you and, more importantly, your small children if you have them. Also, if you have been experiencing cold-like symptoms, it is recommended that you consult your doctor because there is a high chance that you have already been exposed. If that is the case, there are antibiotics available that will speed up the healing process. To conclude this segment, I would like to point out just how serious this disease can be, as it is the 8th leading cause of death from infectious disease, causing 400,000 deaths each year. Thank you for tuning in to tonight's broadcast. Back to you, Dr. Anderson.